I'm Daniel Levine, and this is the Bio Report. One of the challenges of treating neurodegenerative diseases is delivering therapies across the blood-brain barrier. Aliada Therapeutics is developing therapies that use its platform technology that enables the delivery of large molecules like antibodies across that barrier. Its lead program is in development to treat Alzheimer's disease. We spoke to John Dunlop, Chief Scientific Officer of Aliada, about its platform technology, its origins at Johnson & Johnson's Janssen, and the company's partnering strategy for leveraging the technology. John, thanks for joining us.
Oh, thanks for having me. It's a pleasure.
We're going to talk about Alzheimer's disease, Aliada, and its technology for transporting large molecule cargoes across the blood-brain barrier. Let's start with the blood-brain barrier, though. For listeners not familiar with this, can you explain what it is and how it determines what is able to pass through?
Yeah, the blood-brain barrier is a specialized set of cells that really prevent toxic material from getting into the brain and have procedures for how they allow essential nutrients to get into the brain. So it really tightly regulates not only what gets into the brain, but what actually gets out of the brain as well.
The blood-brain barrier plays a critical role in protecting us from pathogens, but this can also serve as an obstacle to treating CNS diseases. How difficult is it to deliver therapies that need to target the brain across the blood-brain barrier, and to what extent is this limited treatment for CNS conditions?
This is still one of the major challenges that we face to develop effective treatments for brain diseases. And it's exactly because of the challenge that you just described, Danny. The blood-brain barrier limits what we can get into the brain. For small molecule therapeutics, we've learned some rules that can allow us to, predict the properties of those molecules that can get them across the brain. But for large molecules or biologics, we've so far not been able to solve that challenge. And so whereas these biologics have revolutionized the treatment of diseases of organs outside the brain, it's a still tremendous potential to be able to sort of deliver these biological therapies across the blood-brain barrier if we can solve that challenge.
Aliada has developed platform technology known as Model. This is technology that began at Janssen Pharmaceuticals. How did Aliada come to own this technology, and what has it done to further develop the platform?
Yeah, this started with conversations with some of our scientific co-founders who were part of RE Capital, who were looking for interesting technologies or even therapeutic molecules that might be available at companies to sort of bring in and sort of really form the basis of a new company. And this sort of came from conversations with JJDC, which is the venture arm of Janssen. And they sort of indicated that this technology had been developed over a number of years inside Janssen. They were starting to think that maybe the technology would be better off if it was inside a company that could focus exclusively on this technology to really realize the potential. And that was the conversation that led to the formation of the company over a couple of years ago.
What is Model and how does it work?
So Model stands for modular delivery, and it really reflects the fact that we have a very modular platform for how we can help to deliver these large protein therapeutics across the blood-brain barrier. We essentially have these optimized protein delivery modules that take advantage of normal transport mechanisms at the blood-brain barrier that are normally responsible for transporting nutrients into the brain. And so we can essentially hijack those transporters. We can configure our models onto different therapeutic cargo molecules And in that way, we can enable the molecules to get into the brain and ultimately to have, hopefully, potential therapeutic benefit.
Can you alter any antibody with this approach to enable it to cross the blood-brain barrier?
This is one of the real differentiating advantages of the model technology, in that we can actually alter essentially any antibody or large molecule biologic cargo because the protein delivery modules are very small, so we can attach them onto different sites of different cargoes, and we can retain all the full functional properties of the antibody. We don't have to make any changes to that. So this is a real advantage of the technology.
Aliada is using this platform to develop a pipeline of therapies to treat CNS condition. Its lead experimental therapy is in development to treat Alzheimer's disease. For listeners not familiar with the condition, what is it?
Alzheimer's disease is the most common form of dementia. And dementia is essentially, characterized by problems with memory, but then many other things. And so it's a disease that I think impacts essentially all of us, either directly or indirectly. And it's estimated that there's around 7 million individuals currently in the United States living with Alzheimer's disease.
And how does it manifest itself and progress?
So there have been a lot of studies to try and understand what contributes to the development of Alzheimer's disease. One of the key discoveries was the discovery of a protein called beta amyloid that becomes abnormally folded and misfolded in the brains of patients with Alzheimer's disease. That amyloid triggers a pathological cascade that ultimately leads to the death of neurons. And this progresses over the course of many, many years within an individual's brain. And in fact, we learned now that amyloid pathology can start to develop in the brain of an individual perhaps a couple of decades before they even present with any of the first clinical signs of sort of memory impairment.
And what treatment options exist today?
Right now, the treatment options are very limited. There are some medications that provide modest symptomatic benefit to patients, but I would emphasize that's very modest. And then more recently, there have been some medications more on the large molecule antibody therapeutics that are designed to essentially remove this toxic amyloid from the brain and restore memory function. Those have shown some evidence of clinical benefit, but as we've discussed, the challenge of the blood-brain barrier has so far limited the amount of these therapeutics that can get into the brain. And so there's still really great room for improvement on what has now been some initial amyloid-targeted therapeutics that have shown some success in the clinic.
What's the prognosis for someone diagnosed with the condition today?
The prognosis is not very good for the reason that I just described, that we don't have good therapeutics that we can actually administer to individuals. So individuals will progressively deteriorate with their memory function. There'll be other psychiatric symptoms can often be common. Eventually, ultimately, people are unable to, sort of function independently and often then end up going into some kind of.
This has been a challenging area of drug development. Why have drug developers had such a hard time successfully developing drugs that can halt progression of the disease, let alone reverse it?
I think one of the biggest challenges in some of the early trials attempting to intervene in Alzheimer's disease were related to definitive diagnosis of the disease. In those early trials, we didn't have good biomarkers that could confirm in an individual that they actually had Alzheimer's dementia. They may have had other types of dementia. And it was only when those individuals came to autopsy could we confirm whether they had these beta amyloid plaques in their brain or not. So one of the real advancements that we've made in the field that has really enabled us to do better trials in Alzheimer's is we can now image these amyloid plaques in a living individual, so we can actually measure those and confirm that the person does indeed have the amyloid pathology. And so we can be more confident that we're actually recruiting individuals into the trials that actually have Alzheimer's disease and Alzheimer's pathology. So it really advances in biomarkers have really made it sort of better to do clinical trials in Alzheimer's disease.
Your experimental therapy, Alias 1758, was licensed from Janssen. What is Alia 1758 and how does it work?
So Alia 1758 is what we call a bispecific antibody. So that means that it actually binds to a couple of different antigens. So we actually target a form of the amyloid beta protein that's called the pyroglutamate amyloid. This is known to be a particularly aggressive aggregation prone form of beta amyloid. So that's the therapeutic target of the antibody. And then we configure onto the antibody our model technology that targets one of the brain transporters to improve the amount of Alia 1758 that we can get into the brain relative to an antibody that doesn't have the model configuration.
You were on target to enter the clinic in the second quarter of 2024. Is that still the case?
Yes, we're very excited that we are very imminently going to be starting our clinical trial. We're very excited to say we've now become a clinical stage company. So that study will in fact be kicking off in the second quarter.
Oh, what's known about 1758 from studies that have been conducted to date?
So we've generated a very comprehensive preclinical data package to demonstrate that we can support the proposed mechanism of action of Alia 1758, that it does indeed bind to these pyroglutamate forms of amyloid beta. We can show in preclinical species, because we've configured it with the model delivery module, that we can see increases in brain concentrations of Alia 1758 relative to comparisons to an antibody that don't have the model configuration. We've shown that we can reduce amyloid plaques in a preclinical model of Alzheimer's disease. And we've also done our preclinical toxicology studies to show that it supports advancing the molecule into early human studies that has a good safety profile to move into early human trials.
You've touched on this a bit, but one of the challenges with Alzheimer's is treating patients early enough in the progression of the disease to have a meaningful effect with a therapy. Are there inclusion criteria or other steps you're taking to identify patients at an early stage?
Yes, absolutely. This gets back to my earlier comments on the promising biomarkers that we now have in Alzheimer's disease that we didn't have in many trials years ago, where we will have an inclusion criteria that individuals do need to have a positive signal for imaging of amyloid plaques in their brains. And then we'll have additional measures that we will do on blood samples where we'll look for amyloid species in the blood as well. So that will give us confidence that we have individuals who have Alzheimer's dementia.
And what are you using as endpoints for the study?
So the endpoints in our early clinical trial will be mainly to establish the initial safety and tolerability of Alia 1758. We'll also be doing some measurements to understand how much of Alia 1758 can we measure in the cerebral spinal fluid. This will give us confidence that we are indeed getting greater concentrations of Alia 1758 into the brain. We'll get a very good understanding of the pharmacokinetic properties of Alia 1758. And that in total will be the main focus of the initial study. And with that would put us in a very good position to then ultimately plan to go into a study in Alzheimer's patients.
You have other programs in the works, but haven't disclosed them yet. How are you prioritizing those? What are the considerations you're weighing? What would make an ideal candidate given this technology?
Well, we've certainly shown a strong validation for the model platform using antibody therapeutics like Alia 1758. So that's obviously one area where we're thinking very carefully where there might be other antibody targets that we could potentially configure with the model therapeutics. One area that we've been really excited about is in oligonucleotide-based therapeutics, which are currently very challenging for brain diseases because you have to deliver those by the intrathecal route of administration, which itself is associated with a lot of toxicity. And so we see a lot of potential to be able to make these delivery module oligonucleotide conjugates and then deliver those through either IV or subcutaneous administration and then achieve the desired effect in the brain.
I would also think that given the ability of a company like yours to develop a large pipeline and the potential for this technology, there may be large opportunities for collaborations and licensing. Are you pursuing a partnering strategy at this point?
We are, and we've actually had a lot of interest to, sort of consider where we might be able to partner with, both with Alia 1758 as our lead program, as we already mentioned, but also on other potential applications of the technology. And we see broad potential here. I've already mentioned antibodies. I've mentioned oligonucleotides. There's potential in enzymes where we actually already have an active collaboration with a small company called Chiesi. There's peptides and other proteins. And actually, we've had some conversations with companies who have interesting antibodies themselves and recognize that their challenge is to solve the challenge of delivery. So we think there's a number of different options that we could explore from a partnering perspective, and we're certainly very interested in that.
Johnson & Johnson Innovation Labs provided seed funding. How much have you raised to date, and how far will existing cash take you?
So we're well capitalized right now. We currently haven't, made public our raise, and we will continue to capitalize the company as we need to. But we're intending to be able to fund ourselves through a proof of concept study for Alia 1750 in patients, as well as to advance our earlier stage pipeline, as we've already mentioned.
And what's the plan for raising additional capital?
We'll always be thinking about what our runway is and looking to put the company in a good position from a cash perspective. So that's always something that we're paying attention to. But at the moment, we're well funded to proceed with the studies that we have in the next 12 to 18 months.
John Dunlop, Chief Scientific Officer of Aliada Therapeutics. John, thanks so much for your time today.
Thank you, Danny. Thanks for having me.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.